Today's SnapOrtho video is going over the TLICS classification, also known as the Thoracolumbar Injury Classification and Severity Score. So let's head to the TLICS ice cream shop. This will help us remember the purpose of this sketch. The break in the glass will remind us that we use this classification for the management of thoracolumbar spine trauma. So let's head inside. So there are three parts of the TLICS classification that will make up a final score. The first is morphology, and this banner should help us remember that this is the first part of our TLICS score. Our first ice cream sandwich is wedge shaped. This is our first type of morphology, where the vertebral body becomes compressed at the anterior column, but the height is maintained posteriorly. Our second morphology in the classification is a burst fracture. The ice cream sandwich with ice cream bursting out the back should remind us that this fracture pattern can involve both the anterior and posterior column, as well as be associated with retropulsion into the spinal canal. The third morphology in our classification is due to a rotation or translational injury. This is represented by our swirl ice cream that's slightly leaning over. Our fourth morphology in the classification is a distraction type injury, which is represented by our double-decker ice cream sandwich being pulled apart. Be cautious of damage to the posterior elements in these type of injuries. Each fracture pattern morphology is associated with a different number of points that contributes to their total TLICS score in order from least severe to most severe. The second part of our TLICS classification is neurologic status, represented by our patrons here wearing their neurostatus hats. The first patron is wearing lightning pants, which would help us remember radicular symptoms. Our second patient is sitting in a wheelchair, a recurring symbol for a spinal cord injury. And look on his t-shirt, the entire spinal canal is red, which should help us remember this is a complete spinal cord injury. Our first two patrons are sitting at table 2 to remind us that radicular symptoms and complete spinal cord injuries are associated with 2 points in the TLICS scale for neurologic status. He's also holding a burst ice cream sandwich to remind us that burst fractures are also 2 points. Let's check in on our third patron. This is also neurologic status, and he's holding a peeled banana, our recurring symbol for cauda equina. And look where he's sitting. That's not a normal seat. That's a saddle. This should remind us of saddle anesthesia, and the poop on his shirt and the pee going down the seat should remind us of bowel and bladder incontinence associated with cauda equina syndrome. Our fourth patron is also in a wheelchair, reminding us of spinal cord injury, but the spinal cord hemisection on the back of his shirt is only covering the center portion, which is representing an incomplete spinal cord injury. They're both seated at table 3 to remind us that these neurologic statuses warrant 3 points in the TLICS classification. Our fourth patron is also holding our swirl ice cream that's slightly translated over to remind us that rotation translational injuries are also associated with 3 points in the TLICS score. Our third and final part of the TLICS classification is our PLC integrity, represented by the PLC to-go window. The takeout box with the ice cream sandwich in it is going to represent our posterior ligamentous complex. An intact PLC, like our takeout box at the window, will represent 0 points. But let's head to table 2, where we see a PLC that's black and some increased signal with white streaks. This should remind us that a suspected PLC injury, which would have increased signal in MRI, will warrant 2 points in the TLICS classification. And over at table 3, the takeout box is torn in half, and this should remind us that a fully disrupted PLC is going to warrant 3 points on the TLICS classification. So once you add up your total from morphology and neurologic status as well as PLC integrity, you get a final score, and a TLICS score greater than 4 is an indication for surgical intervention. A TLICS score that equals 4 will vary based on patient factors and surgeon preference. So whenever you're working up thoracolumbar spine trauma, just remember your favorite ice cream store in the TLICS classification. In brief summary, morphology is the first part of the classification, 1 point for compression fractures, 2 for burst, 3 for rotation translation, 4 for distraction. Neurologic status is the second part of the classification, 0 for intact, 2 for nerve root injury or complete spinal cord injury, 3 points for cauda equina or incomplete spinal cord injury, and the last part is PLC integrity, 0 for intact, 2 points for suspected injury, and 3 for injured. A score of less than 4 is non-surgical. A score of 4 is surgeon preference. Greater than 4 warrants surgical intervention. I hope this sketch was helpful, and we'll see you next time at the TLICS ice cream shop.